Okay. Start, Jamana.
Very good afternoon to everybody, and thank you for attending this session. On the eve of World Plastic Surgery Day, which is tomorrow, the 15th, this session has been planned to give us a little bit of insight into plastic surgery, its various subspecialties or sub branches that we deal with, and then what is the scope of plastic surgery. In plastic surgery, grossly, it is derived from the word plasticos, means moldability of the skin. It's derives from a Greek word. We cater to surgeries from head to toe, depending on deformities, deficits of tissue, enhancing the beauty of an individual, which is cosmetic plastic surgery, reconstruction after cancer, involving various parts of the body, improvement in form and function of the body. Microsurgery is part of plastic surgery, wherein surgery involves smaller parts like blood vessels, and nerves, which are anastomosed or joined together. And this armamentarium is useful in cancer surgeries and trauma, wherein limb amputations or finger amputations need anastomosis to tinier structures or smaller structures. Cosmetic surgery involves surgery to enhance the beauty of the individual. It is not only for an improvement in physical form to enhance their confidence, but also useful wherein such problems cause them functional issues also. For example, breast surgery, wherein you have enlarged large breasts, which are disproportionate to the body form, disproportionate to their physical form or stature, and they cause neck or back issues. And in inframammary folds, there's a lot of sweating, itching, and it causes discomfort to the individual. Apart from that, large breasts cause young women a feeling of being the point of focus when they socially interact with other individuals, and also when they play a sport. They feel that the movement is hindered and the focus is on the individual's anatomical part rather than the performance. So this leads to a lot of inhibition in women carrying on certain sports activities. I've seen individuals being affected psychologically also because of this, and then they do not take up certain sports, they do not take up certain occupations, they do not wear particular kinds of dresses or garments which make it obvious. Apart from causing physical issues such as neck, back discomfort, or inflammatory itching, and finding apparel which is undergarments which are appropriate for them. So such individuals usually seek a consultation, and then when that consultation happens, we do certain measurements, looking at their body proportions, and then advising accordingly as to what is the usual size which is expected, subsequent to breast surgery, and where physically comfortable breast size is appropriate for them. We come into an agreement after speaking to the individual. If a surgical plan is made, it involves different surgical approaches depending on the surgeon's expertise, know-how, and patient's requirements. Subsequent to the surgery, there is necessity to wear some compression garments. The surgery itself will take a couple of hours to 5 hours. Both breasts are being done. The surgery is being done, and subsequent to the surgery, patient is given some compression garments which they've been asked to wear for 6 weeks. What can go wrong? People tend to ask that how do you proceed for this surgery? So apart from blood tests, and physical fitness for the surgery, which is being assessed by the anesthetist. When the patient undergoes the surgery, the wound is usually stitched with absorbent suture materials, which take from a couple of weeks to a couple of months, depending on the suture material that has been used. So it results in certain scars, which usually efface or reduce in their prominence by 6 to 9 months. So scar prominence, scar hypertrophy can be one of the issues which results as a result of the surgery. Apart from scars, there's a possibility of an infection or bleeding in any surgery for that matter. Adequate hemostasis, if taken care of during the surgery, usually does not result in such problems. And certain surgeons put drains, which is a tube which lies within the breast tissue, which comes out of the skin, and they usually take it out after 1 to 2 days, or in very occasional instances after a couple of days. The patient usually goes home after the surgery. Hospital stay is about 1 to 2 days, depending on the surgeon preference. Longer if there is any issue, but usually it is a well-done surgery in an ideal patient. It does not result in longer stays. The follow-up is after a week, usually. We look at the dressings, change them, advise on topical wound care, and if there is any wound healing delay, they're advised how to manage it. Compression garments are worn day and night so that the breast shrinks back in size. Because subsequent to the surgery, there is edema, is enlarged, the breast appears enlarged. Though it is reduced from the initial pre-surgical volume, it still appears larger than it would subsequently be in a couple of months. So, patient is advised on the compression garment, and their anxieties are laid. They're told that the breast would finally settle in the final shape or size after 6 to 8 weeks. Local wound care, compression garments, and general follow-ups will be there till the patient wound heals properly, and they're advised on physical activities subsequent to the surgery. Usually 1 to 2 weeks later, they are allowed to go about their exercises like quick walking or treadmill or running or jogging. Contact sports, we advise them not to engage in the first few weeks. The final scar settlement happens after 6 to 9 months, and adequate scar management techniques are taught. So this is in taking you through the steps of breast surgery, which is a reduction. Is what I was intending to tell them in a little bit of detail. Other surgeries I can take you through are, there are some questions which I would like to deal with. The umbilical hernia surgery without mesh. When can I do yoga, stretching, swimming, bicycle, aerobic, lightweight training? Kindly answer. So this is a patient, it looks like it's a Dr. Sehan Al-Rais. So if somebody has an umbilical hernia surgery, what is an umbilical hernia? It is a defect. This specifically is to the listeners, apart from the doctor's question. I'll answer the doctor's question. An umbilical hernia is a defect in the abdominal wall through which abdominal contents can push out. So the repair has been done in this case without the mesh. Mesh is put wherein the rest of the abdominal wall can be weak and there is a future of recurrence of this hernia. So if it is done with a good repair, with the facial repair being done and the muscle strength is good, we ask patients not to lift weights for 3 months. General returning to activities like exercises, which is running, stretching, can be undertaken in 2 weeks' time once a soft tissue heals adequately. Swimming, bicycling is dependent on the individual because they are not going to put pressure on the abdominal wall. If the wound has healed adequately, a patient is feeling comfortable to engage in these activities. In 2 to 3 weeks' time, they can get back to their usual activities. Again, aerobic lightweight training, as long as intra-abdominal pressure is not raised to a significant degree. So straining, what I mean when I'm saying intra-abdominal pressure is when you strain to increase abdominal pressure. Those kind of exercise can be avoided and rest of the exercise can be carried on. I hope Dr. Sehan Ali Rai's question is answered with this. If there is anything else, you can message me, doctor. The second question by the doctor is, can the wrinkles above the breast removed also with the breast reduction, and can I choose the size? If the breast is lax, it would be a diffuse laxity all around the breast. So when you're doing a reduction, you can address all around laxity by the technique that you choose, depending on the size of the breast and the doctor's familiarity with the procedure. When I say familiarity with the procedure is the kind of pedicle that he uses, the kind of skin excision pattern that the doctor chooses. So a straight answer would be yes, you can address it by breast reduction. And by choosing the size, the limitation of choosing the sizes without harming the nipple and areolar complex. The pedicle that I usually choose is a supromedial pedicle with a vice pattern skin excision. When you do that, supromedial part from the chest wall is where the breast is getting the blood supply and the nerve supply. So you have to leave adequate breast tissue underneath the pedicle and allow it to turn up into the proposed nipple areolar complex that you're proposing. So whatever breast volume that you want to remove is apart from the supromedial pedicle, keeping a good thickness of the skin. So superiorly, laterally, inferiorly is where you're removing the breast tissue. So you can thin the skin paddle, so not the skin paddle, skin thickness of the flaps to a decent thickness only, keeping the edge vascularity in mind. So that is your limitation of the final breast size that you want to. So if there is a breast of a large breast reduction of 1 to 1.2 kilos, you have to be careful that the supromedial pedicle or the pedicle that you choose is not devascularized. The sensation is not going to go, and then the rest of the volume comes off. So a couple of breast sizes can be reduced. So 36 can come to 32 breast size, and the cup size reduction happens quite significantly. I hope that answered Dr. Sainal Rice. So the other cosmetic surgeries that come into the spectrum are abdominoplasty. Abdominoplasty is usually done in women because the reason for lax abdominal wall is pregnancy, multiple pregnancies with a lot of stretching of the abdominal wall, not doing adequate post pregnancy exercises, not wearing a binder, and in generally genetic makeup of the skin and inelasticity of the skin, because in pregnancy the abdominal wall is stretched quite significantly and it doesn't recoil back to the same degree in every individual. So there are some models, actors who maintain their fitness and skin tone quite significantly well. So for them, post-pregnancy, post-delivery, usually majority of them are, it returns back to their initial pre-pregnancy look or lack of laxity, and they are quite happy. But in some individuals where there is a predisposition, fitness is a little bit of a question, or due to stretch of the abdominal wall, which is quite significant due to large baby, large volume, large size baby, or a lot of fluid in the abdominal wall. Welcome, Dr. Sahan, for your question, and thank you. So in such instances, the abdominal wall is lax, hangs below, is unsightly, makes them lose their confidence, makes the individual lose their confidence. They're not able to wear adequate, appropriate clothes, and they feel inhibited. Such women, they might also have a hernia associated with it, umbilical hernia usually, and divarication of recti. That is, the abdominal muscles in the center, they are weak, they are stretched, and they move laterally. When they move laterally, the fascia in the center is where the push of the intra-abdominal contents happens. So loose abdominal wall, which is hanging down below the level of the groin, along with or without an umbilical hernia, or without a divarication of the recti, which are recti central muscles from the xiphisternum, that is the sternum arch, to pubis, which is just above the lowermost part of at the level of the groin in the center. So any one of these might be associated with a lax abdominal wall and need addressing. So this surgery, the surgeon assesses you first, takes you through the steps of the surgery, arranges for an ultrasound of your abdomen to look at the hernia, and plans for the surgery, keeping in mind that there might be a mesh required during the surgery. Why do you put a mesh? Now, the hernia has happened because the wall has become weaker. It can be central weakness or lateral weakness. If there is only a hernia centrally and the rest of the wall is, the abdomen is stronger, and the looseness is more of lower part of the abdomen, an abdominoplasty will suffice, along with the umbilical hernia repair. If you have divarication of recti along with lateral abdominal wall which is weaker, then you need a surgery which corrects all these parameters. So then you might need a mesh. A mesh can be an absorbable mesh or a non-absorbable mesh. So the mesh is put in different planes. It can be done laparoscopically or can be done physically, because you're going to take the loose abdominal skin with the fat away. So at that stage, you will do an adequate dissection between the skin and fat pad and the abdominal muscles, tighten the abdominal muscle strength centrally, reduce the hernia, and repair the neck of the hernia. Place a mesh if the wall laterally is also weak. Centrally, you feel that the repair may not be adequate and then they might develop a hernia. Place the mesh in place, stitch it up, put a drain, and close the abdominal wall after removing the extra bit of skin and the fat. So the surgery takes about 5 hours for the individual. It is undertaken after explaining this whole process to the individual, and they're advised to speak to the anesthetist about their fitness for surgery, about possible complications which might arise. What are the complications? In any surgery, as I mentioned earlier, there's a risk of infection, there's a bleeding, scarring, wound healing issues. Wound healing issues can happen in the central part of the wound or lateral part of the wound. Normally, we do not get inside the tummy. The surgery is done only above the muscle plane, above the abdominal wall muscle, and you take away the extra skin and the fat. So intra-abdominal complications are lesser, and the problems I mentioned, which are quite common, are infection, bleeding, and scarring. Good surgery with adequate hemostasis rules out a hematoma or a seroma. Hematoma is a blood collection, seroma is a fluid collection. Sometimes people have breakdown of fat cells with a lot of fluid produced in the abdominal wall, between the abdominal wall and the skin, subsequent to the surgery. So sometimes such problems can happen, and wound healing delays can happen centrally or laterally. If the repair is too tight, wound healing issues might happen centrally. Even if the repair is adequate, sometimes the blood supply might not be adequate for the lower part of the abdominal wall skin, and you might develop a gape which heals slowly. After the surgery, the patients are put on a catheter so that their mobility, because of the duration of the surgery, and their initial mobility might not be great during the first day. The second day is the patient is made to walk about. If their BMI is slightly on the higher side, or if their mobility is suspect, we put you on blood thinners. Subsequent to the surgery, there is a dressing put and a pressure garment which has been put, and the patient is mobilized post-operatively the next day, and advised to drink adequate fluids and given adequate painkillers. This surgery is not would cause some discomfort but not unbearable pain, and we make sure by giving them adequate analgesia. Some women remain in the hospital for 3 to 4 days, and then they go home with or without the drain. A drain is a tube which is left between the abdominal wall and the skin, and plays a role of taking out any extra fluid which collects there. So if the drain volume is significant, more than 50 ml per day, some surgeons leave it and advise the patient to go home with the drain, and they're asked to come back at a later stage when the drain is less to be pulled out. Taking away drain is not a painful procedure, and you don't need any anesthesia or anything like that. The stitch which anchors the drain is cut, and then the drain is pulled out, it slides on. Some people in abroad put a dressing called a perineum, which is like a mesh with a glue stuck on the wound, and they are allowed to shower after 4 to 5 days. Some put dressings which need to be changed only if soaked within a couple of days. If not, a week, the dressings are left in place, and the dressing removal happens after a week. Scar management is taught. We advise them about a scar massage for a couple of months. Advised to mobilize, and they are advised to not lift any heavy weights for the first 3 months and carry on with their exercise and general activities for the after 2 weeks. If the wound is healed well and they are happy to go about without any physical discomfort. Dr. Anusha Reddy has a question. Hello, sir. Good afternoon. Can you please kindly explain the complications of massive liposuction and safe amounts to be suctioned in one go? Good question. Weight loss is not the indication for liposuction. As long as we can remember that, we are usually working within safe parameters. Liposuction results in a lot of electrolyte imbalances done in larger volumes. So post-operatively, there's a lot of fluid shift which happens. If you do large volume liposuction like 10 liters or 12 liters, safe liposuction is usually up to 6 liters in an individual. It depends on the body habitus and any pre-existing medical problems and the fitness of the individual. So usually an abdominal liposuction in individuals should be done if you have resistant deposits of fat, if the individual is not able to lose them in spite of exercising, flank fat or lower abdominal fat or arm fat or thigh fat. And then if they've got a good skin tone also, it settles back quite soon in a more aesthetic manner. So if you do large volume liposuction, what I mean is if you do 2-3 parts, then your volumes you're going to go above on your volumes. 4 liters to 5 liters is what you usually get in abdominal liposuction. If there is a thinner abdomen with resistant deposits in the lower abdomen of the flanks, probably 1 to 2 liters. Gynecomastia, 500 to 1 liter. Thigh liposuctions, if there are deposits in the gluteal area in the thigh, again you're going to add to the liposuction volume that you're doing. So about 2 to 2.5 liters in each of the thighs. So when you're choose the body parts which you are going to be within safe parameters of 6 liters in a single go. That would keep you safe rather than doing large volume liposuctions. Hitting a vessel, again, if you're hitting a vessel and you're getting any bleed, put some pressure, make sure that there's no further liposuction in that area, and you inject adequate tumescent before the liposuction. And if it bleeds also, put some tumescent in that area so that the adrenaline in the tumescent makes sure that there is hemostasis in that area. And compression garments adequately in those areas. And if you're dealing with a different area and there's been a bleed in one area when you're doing a liposuction, continue some manual pressure also and make sure that there is adequate hemostasis to avoid any complication. So an answer to your question would be 10 or 12 liters is a big volume liposuction. If done, you have to be prepared for the fluid shifts, for the blood pressure falls and blood pressure increases, electrolyte imbalances. Sometimes some people need ventilation post-operatively. They need to be ventilated overnight till they recover adequately subsequent to liposuction. So I think Dr. Anusha, have covered the volumes of liposuction that are safe. So as regards the abdominoplasty, which I was talking about earlier on, exercise. 2 to 3 weeks time is adequate for a well-healed abdominoplasty to start on a gentle exercise, and they can increase it as per their comfort level. Dr. Sehan Alvais has got another question. Diaphragmatic breathing exercises after 10 days of umbilical hernia surgery. Is it safe? Breathing exercises are good post-operatively because you do not want anybody to develop lung complications. When they are wearing their abdominal binder, it protects them adequately to do breathing exercises. So an answer to that is it is safe because your repair is strong enough. I take it that a surgeon who does surgery does it adequately strong. The hernia is repaired well, with or without a mesh, and abdominal muscles are repaired well. And you have not overdone the abdominoplasty by taking too much of extra skin. The individual is wearing, putting a pillow below the knees and maintaining it in a flexed position knees so that there is no strain on the scars, and there is no other problems like chronic cough, chronic constipation. These issues have been addressed with. There is no inappropriate pressure on the abdominal wall, you can safely do breathing exercises. In fact, they are advised so that you don't develop any lung complications and you move about adequately well after the surgery. When there is a mesh repair, there is a risk of an infection if there is diabetes. So in some places where you can avoid, if the wall thickness is good, you can do an adequate muscle repair and avoid a mesh. But if mesh repair is a must, then you carry on, mention to the patient there is a risk of that, though however remote it is. Apart from abdominoplasty, I would like to take you through an arm lift and a thigh lift. A lift is basically, the name as it mentions, is done when there is a sagging of tissues or laxity of tissues. Rohit Krishna has got it out. Hello sir, good afternoon. Can you please brief about eyelid surgery like entropion? We'll speak about eyelid surgery now. Entropion, the word meaning is what the problem is the eyelashes of the eyelid are turned inwards rather than being in the normal position of being outwards. So the inward turned eyelashes cause irritation of the eye, excessive watering of the eye, redness of the cornea, and if the lashes are too sharp, they can dig into the cornea and cause corneal injury. The patient is in being constantly bothered with this, and they request for surgery. So entropion surgery, you should look at the reason. Is it acquired due to trauma, post-surgical, any infection, any surgery in that area? So an interned eyelashes to be turned outward, if there is a lot of laxity of the skin, you trim the lax skin so that, and create a pull on the lower lid or the upper lid to make sure that the eyelashes turn outwards. If there is laxity of the muscle or disinsertion of the muscle, you repair the orbicularis muscle. At the level of the tarsal plate or mid part of the orbicularis of the eye, the problem could have been there, you can address it. So it depends on, is it skin excess, the eye turning inside, is it scarring that is causing the entropion, is it muscle laxity or disinsertion of the muscle that is causing it? You address it depending on what you think is the cause for the entropion. Dr. Sehan Alrice, my hernia was 13 millimeters and was without mesh. Yeah, I would agree with you that it does not probably require a mesh depending on the hernia size. It is a size. It also depends on the lateral muscle laxity. If the muscle is weak and there is a possibility of hernia from the lateral part of the abdominal wall, that is when you can use a mesh. For a 13 millimeter hernia, if a good muscle surrounding laxity, it does not need a mesh. I agree with you. So that is about the entropion surgery. It can be done under local anesthesia or general anesthesia, depending on the convenience of the patient. You put a steri strip and absorbable suture material. Some use proline, which is non-absorbable, and they draw it out at the end of a week. The approach can be from outside through below the lash margin or in a skin crease, depending on the requirement. As regards I hope that answers doctor's surgery about entropion surgery. Yeah, Dr. Roy says the muscle was strong, that's why I didn't use a mesh. That's good enough. As regards arm lift and thigh lift. So the laxity of the skin is when the lift is required. Even in an abdominoplasty, we were talking about the loose skin hanging down. In an arm lift or a thigh lift, there is loose skin in the arms, and when the arms are placed laterally with elbows flexed at 90 degrees, you can see that the skin hangs there due to lax skin and the fat there. This can happen due to massive weight loss. Again, in lax abdominal wall can result in massive weight loss. In loose breasts, extra skin can happen during massive weight loss. And arm laxity or thigh laxity can happen in massive weight loss. So this loose skin inhibits them in wearing certain kinds of clothes. Hanging skin makes them lose their confidence. So this extra skin is removed. It's a physical surgery that needs to be done. So any physical surgery is a cut, which the scar is inside the arms, in the inner aspect of the arms. not visible to the outside. One transverse part of the scar lies in the armpit, and longitudinal scar in the medial aspect of the arm. You try to limit the vertical scar, which can be visible if it crosses the mid-arm in certain individuals when they turn their arms outwards. So you try to, and also depending if it is a woman, you ask them what garments they usually wear, and if the length of the scar can be kept hidden within the clothes that they wear. The marking is done, keeping all this in mind. Extra skin with the fat is trimmed, and the wound is stitched. Usually there are no drains. Wound is stitched with absorbable suture material. The pre-op workup is the same. The blood test, the anesthetist, and stuff. That is common for all surgeries. It can be done as a daycare or one-night stays advised in the hospital if you're doing a thigh lift along with the arm lift. So both arms are done in one go. Sometimes liposuction is also done along with the arm lift if the lateral part of the arms are thicker or certain specific areas need to be addressed. Combining arm lift with liposuction results in some vascular issues for the scar area, and you can have wound gape at a later stage. Similarly, combining liposuction and abdominoplasty may result in certain complications like wound healing delays because the blood supply to the flap, which comes from the top or subcostal area, may be hindered. So once the arm lift is done and extra skin and fat is trimmed from both the arms, intraoperatively itself, the compression garments are placed and the patient is asked not to remove them for a week. And after a week, the dressings are changed and the patient is advised to continue with the compression garments for at least 6 weeks. There is post-operative edema in any surgery, and the tightness which resolves post-surgery usually resolves slowly over a period of a couple of weeks and settles. Scar management techniques are taught in the usual way with massage and graded pressure, which increases over the next couple of weeks. There's one more question. Mr. Sai Kiran Chandra. Hello, sir. Would like to have a rhinoplasty done. What would be the procedure and recovery period? Now, rhinoplasty is a surgery which is done for correction of the shape of the nose. It depends on is it a bony part, which is an issue, tip of the nose, which is an issue, or the cartilaginous component of the nose that is an issue. So starting from the root of the nose, the bony part of the nose extends, and then the cartilaginous part, and then the soft tissue part or the skin part of the nose. Tip correction or alar base correction also may be required. So first thing is a consultation with the plastic surgeon to see what components or what needs to be addressed from the point of your view. That is, from the patient's point of view, because your nose, you know better than anybody else as to what correction you want. Physical structures need to be addressed depending on what you have in mind, and the surgeon explains to you what is possible, what is not possible. The problems in rhinoplasty are mostly arise from expectation and what is possible. If the surgeon is clear in their mind about what can be corrected and what percentage of expectation can be met, and this is communicated to you as a patient, and you're happy, both of you concur in what physically is the issue and what is the expected outcome, then you carry on with the procedure. The procedure can take from a couple of hours, starting from 1 to 2 hours to 4 to 5 hours, depending on the extent of correction that is required. So preoperative photographs are taken, front, lateral, and lower part of the photographs. Any issues which are there prior to the surgery, if the pictures are not taken, post-operatively it is assumed that it is because of the surgery, including the nostril width and alar base width. So photography helps in the patient appreciating the post-operative result apart from documenting what was wrong prior to the surgery. Some blood tests are done. Again, the anesthetic check is done, and subsequent to the consultation, and the surgery is planned. So you come to the hospital on the day of your surgery, have the surgery. Subsequent to the surgery, what you can expect is, if it is an open rhinoplasty, that there is a small cut made at the base of the nose. So below the tip and between the base, more towards the base of the nose, is a cut made, and the nose skin is lifted up like a flap. The correction is done. Closed rhinoplasty is an incision which is inside the nostril, each of the nostrils, and the correction is done that way. Depending on a nasal pack that is being put, the patient might, once they wake up, they will notice that the nose is packed with a tube-like structure which allows them to breathe, or a completely blocked nose, and this blockage is taken out the next day. So they might find it a little uncomfortable to wake up this way and be able to breathe through their mouth. A little bit of serous fluid might, a little bit of bloodstained fluid might drip through the nose, which will reduce slowly. There might be bruising of close to the eyes and on either sides of the cheeks, close to the nose. This bruising takes a couple of weeks for it to settle. Whenever a nose is operated, there's a lot of swelling in that area, and again, this will take a couple of weeks to settle. Any changes which have been made, usually tip changes for them to use, for you to see a final result takes a couple of months, 1.5 months to 6 months for any final tip changes. Nasal bones, if they've been corrected, the width is reduction is more or less obvious, a little more earlier, in a week to 2. But again, the final edema settlement takes a couple of weeks. Upper and lower cartilages which have been changed, or a tip change, or a columnar change, which is the central part of the nose, takes some time for them to mature into a final shape that you're going to see. Disappointment stems from expectation. So too many physical changes which are done makes them look very different, which might not be bad, but the patient might not identify with their initial look. So an expectation should be that they will look different, and acceptability from your peers, from your friends, from your family goes a long way in you settling into your new nose. So I would say that when you listen to how you look, you should be acceptable to the change. Your mind should be acceptable to the new nose, and you should give it time enough for you to accept the new nose. So I think Mr. Ranjit Reddy is that. Okay. So that answers about rhinoplasty. Dr. Anusha Reddy. Can a nullipera undergo abdominoplasty? Will it affect future pregnancy? The answer would be a nullipera coming for an abdominoplasty is usually less. It can happen if they have lost a lot of weight, they have a lot of weight in lower part of the tummy, and cosmetically they want to have a surgery. In such an instance, all we are doing is, at the level of C-section scar, the cut is being made, and the extra lax skin and fat is being trimmed. I take it a muscle repair may not be needed unless if there is an associated divarication of recti. So a repair done does not cause any problems usually in there if they become pregnant in a future setting, because the abdominal wall is being stretched gradually, and the scar is in the lower part of the abdomen, through which, if a C-section is required, you're approaching through, and you're not going to violate the intra-abdominal content by cutting the muscle during an abdominoplasty. So usually yes, but it would be patient-centric, and an ultrasound needs to be done to see what are associated problems in a nullipera with lower abdominal wall laxity, with or without hernia. Dr. Sai Kalyan. Yes, sir, good afternoon. How can acanthosis nigricans marks be removed apart from weight loss and exercise? That's a difficult one. Acanthosis nigricans, the dark pigmentation is pretty difficult from a cosmetic surgical point of view. I would think that if it is in an area wherein the scar can be hidden, a surgical option. But I would suggest see a dermatologist. I don't think a plastic surgeon, from a conservative point of view, medical management would be ideal. So I would say see a dermatologist. Ranjit Reddy. Hello, sir. Good afternoon. Can you please explain about scar revision and outcomes? Scar. People are under the wrong notion that plastic surgeons can make the scars disappear. First of all, if you're operating, if you're cutting, you leave a scar. How minimal the scar is, how well the scar settles, it depends on a lot of factors apart from the surgeon factors. Their wound healing, innate wound healing ability, where the scar is, post-operatively how the scar has been managed, has there been adequate scar massage, have there been silicone gel sheets which have been used, have there compression garments been used, what is the etiology of the scar, is it a burn scar, is it a trauma scar, so is it a keloidal scar, is it a hypertrophic scar, and where the area of the scar, which part is it on an area of face that you are dealing with. The scar, if you excise surgically, it results in a slightly longer scar. It might be less prominent, but it results in a slightly longer scar. A scar which is present in an unfavorable direction can be changed into a favorable direction. When I say an unfavorable direction is normally face, neck, body has got certain folding lines for the forehead, or for the cheek, or the neck. So if the scar is placed in those directions, it is less prominent to the person who's seeing it. So if it is, let us say, a vertical scar is put in the forehead, it is much more obvious. The scar is transverse, it is less obvious. So a scar which is oblique, you can change the direction of the scar and make it a little more transverse and make it less obvious. A scar which is more thicker or wider can be made thinner by operating on the removing that scar. And scar management techniques like certain creams, massage techniques, pressure garments, silicone gel sheets, they make it, they can work, you can work on them to make them less prominent. So it all depends on where they are, what sort of post-operative result you are expecting, and what can be achieved is what results in the outcome and your happiness as a patient. So that is an answer to you, Mr. Ranjit, that scar revision means cutting, placing them in a favorable line, putting stitches which are usually absorbable, and your expectation of a final outcome can be realized after a couple of months. It takes up to 6 months for them, up to 1 year also in some individuals for it to settle. The other question is from Dr. Sehan Rice. Can liposuction from neck help sleep apnea? An answer to that would be sleep apnea stems from a lot of factors. Sleep sleep apnea stems from narrowing of the airway. It can start from the nose to the back of the throat to the lower part of the throat. So increased fat in the neck is not by itself one factor which causes sleep apnea. So soft palate area, posterior part of the throat area, the fat deposits in that area makes the airways narrow, and when you sleep, the breathing ability is reduced by you not putting enough force, and that is the reason the soft palate falls backwards, so and downwards. So when that happens, the airway becomes narrower, and then you develop the sleep apnea. So neck lipo per se will not improve sleep apnea. Yes. So apart from rhinoplasty, which we have talked about, I can go into a lid blepharoplasty, upper lid or a lower lid. There's one more question, Mr. Ranjit. So can you please comment on blepharoplasty? Yeah, that's exactly what I was talking about. Blepharoplasty is done for individuals who have like eye bag. You hear common words are eye bags. Apart from eye bags, which are fat protrusions of the lower lids or the upper lids, through their contained fascia. So skin has got anatomically outer skin, inside muscle with the fascia, and then the tarsal plate which holds the lid margin. So when there are fat pockets in the lower lid, which are there for every individual, these fat pockets start pushing their lining fascia, and then start showing up outwards as pouches. So medial, intermediate, or lateral pockets, we call them. They start showing up on the outside. When they show up on the outside, the patient looks, the individual looks very tired, and there can be associated loose skin with these fat pads. So blepharoplasty is done to address loose skin, address these fat pads. It can be there in the lower part of the lid or the upper part of the lid. Now the approach. It can be done from inside the lid. That means the scar is not seen on the outside. If there is a fat patch is the only concern. If there is lax skin, the scar has to be on the outside of the lid, in the lid crease. And this scar settles slowly and it becomes really imperceptible usually. So a cut is made below the lash margin or in the skin crease, and you lift up a skin flap, address the fat pads by either excising them or buzzing them, depending on if the fat pads are a concern. If the loose skin is a concern, you excise, trim the skin accordingly. Initial measurements are very important when you address a blepharoplasty. Taking away more skin causes catastrophic problems to the patient by means of lid ectropia, lower lid ectropia or upper lid ectropia, and which is not ideal. The patient will not be able to close the lids appropriately. So the surgeon who is doing this surgery has to be very meticulous about the amount of skin that is removed. And when you buzz the orbicularis muscle, if there is a bleeder, it shrinks the muscle or creates a full effect on the muscle, which affects the lid margin. So you have to keep all this in mind when you're excising the extra skin from the lower lid. And suture materials that are used to close are absorbable or non-absorbable sometimes. The absorbable suture materials are you do not need to remove, but they result in some amount of scar prominence initially, which reduces with scar massage. Non-absorbable suture materials are slided out after a week, and blepharoplasty can result in local bruising, which again takes a couple of weeks for it to settle. Final result will be visible in about 6 weeks. Kind of anesthesia, you can do it under local anesthesia or general anesthesia, depending on patient preference. Local anesthesia, it takes about an hour and a half to 2 because you do it in the slow, patient is awake. Similarly, if you're taking time, it can be the same duration in a general anesthesia. The dressings usually are like steri-strips which are placed after anesthesia, and they might be changed if it is so there is soaking. If not, they're left for a week. Again, upper lid blepharoplasty similarly goes with the same steps. Fat needs to be addressed or extra skin needs to be addressed. Some people have an upper lid fold of skin which comes towards the up to the lash margin and creates a non-alert look. So both these can be addressed by blepharoplasty. Patients are usually happy. They're able to open their eyes much better, and they look less tired and more alert and more lively. I think that addresses blepharoplasty. So the other surgeries like implants, breast implants, from cosmetic surgery point of view. Breast implants, the requirement, the indications are women who have got small breasts, who've got issues with lack of growth of the breast, congenitally also. Some women have smaller breasts, which is the discrepancy of the size is quite significant, more than 50%. One breast is, let us say, is 100, the other breast is about 50 or 25. So in such women, one breast can be augmented by using an implant. Sometimes by lipofilling. Fat is filled into that underdeveloped breast. But again, the skin envelope in an underdeveloped breast might not be enough to succeed with a liposuction, and they might need an implant. Normally, some women have hypoplastic breasts or small breasts, we call it manly chest, and they're looked upon and they're picked up. So it causes a lot of psychological disturbance in them and then lack of confidence. In such women, even pre-marriage, they come and ask for such surgeries. It is done with a very small scar which lies within the lower part of the breast crease. So it can be done as a daycare. You come in the morning and go home the same day. Complications of general surgeries like infection, bleeding, scarring are usual. Apart from that, the other possibilities are that the implant can develop a complication called capsular contracture, which can develop at a later stage in a couple of months to a couple of years, wherein the body forms a sheath around the implant and makes it compressed, and externally it is visible in the form of undulations or irregularity, and the patient feels it as a discomfort. Usually capsular contractures are rare, but it is I just wanted to mention about the possibilities. So there's a risk of infection, which is there in any surgery, bleeding, which is there in any surgery. Adequate hemostasis with meticulous surgery minimizes these complications. Breast implant, some mention, does it need to be changed? An implant need to be changed? Not usually. I've seen individuals who had implants for 20 years and they're fine. So unless there is capsular contracture, infection, a saggy breast which need an upliftment at a later stage, an implant is usually not staged. It can be traded for a second implant at the same time of a resurgery, or a larger implant can be placed at that stage. The implant placement can happen behind the breast tissue if there is some breast tissue, or if the breast is, the woman has a totally flat chest, the implant needs to be placed behind the muscle, partly behind the muscle and partly behind the breast tissue. There is one more question from somebody. Please see this slide. Hello, sir. Good afternoon. Hello, sir. Good afternoon. Can you please explain briefly about effect of breast implants on breastfeeding, and is there a risk of cancer due to breast implants? Good question. Now, we are not disturbing the architecture of the breast to affect the breastfeeding. What the implant is being put behind the breast tissue, which is basically gland. Breast tissue is a combination of fat and gland. Milk is produced by these glands and comes through ducts or tubes to the nipple. So the breast tissue per se is not being cut. The plane behind the breast tissue and between the muscle and the breast tissue is where the implant is being placed, or behind the muscle of the chest wall. So it does not disturb the lactation of the mom. And the second component of that question was, is there a risk of cancer to the breast due to breast implants? There has been a scare about one kind of implants in Europe about breast cancer or lymphoma or certain kinds of cancer in using a certain kinds of implant, which is smooth implant. Textured implants are usually used, and there has been no risk of such risk mentioned with noteworthy data about any risk of breast cancer with such implants. Usually, abroad there is a reflection and there is an accountability and studies on these implants, and when there is an awareness of such, we avoid such kinds of material. Usually silicone breast implants are which are being used. They can be smooth or textured. So depending on the data that is available, if there is a risk, we avoid such implants in breast implant surgery. Even the breast reduction will not affect the breastfeeding. No. Well, answer to that is, depends on the volume of the breast that you're reducing, the residual amount of breast tissue that is there, the amount of production from the residual breast, and the volume of milk that is produced, adequacy of the adequacy to the child. So there's a lot of factors which are coming to this when you say, because young unmarried girls have a reduction. So the question that they ask you, will this breast reduction affect my breastfeeding ability or the volume of milk? Volume of milk, certainly, because let us say you have 100 ml of breast or tissue, and you're making it a 40 ml breast tissue. I'm just talking so that for understanding sake as 100 ml. So let us say you've left only 40 ml. 40 ml or 40 cc of breast tissue will not produce the amount of milk that 100 cc of breast volume would have, residual breast would have produced. So certainly there will be reduction. But if you start from a very large breast and you have reduced it, you might still get some breast milk, which might be adequate, or you might need to top up with other milk. So you tell them that it will be affected, and if it is adequate, they'll be happy. But if it is not adequate, at least you have told them, and the woman is more prepared mentally to supplement the breast. In fact, we will look at alternative solutions for breastfeeding. Milk for the baby. So yeah. So apart from breast implants, mastopexy. Mastopexy is improving the position of the breast and correcting the contour of the breast. So you achieve that by means of looking at the level of the existing level of the nipple areola, the indications as to what needs correction. Is it the breast volume correction along with that, and improving the shape of the breast? It can be done with different kinds of approaches. One approach would be if it is a minimal lift that is a requirement, that is a nipple areola complex is lower and you want to bring it up a little higher. So you do it with a circumareolar incision and bring up the nipple areola upwards. A donut shape or a snowman shaped incision wherein The scar around the areola might not be obvious postoperatively, but there is a vertical scar below the areola extending to the breast crease. Again, a T-shaped scar might also exist if the lateral parts of the skin need to be excised and the breast needs to be uplifted. Both breasts to do it takes a couple of hours, from 3 to 5 hours. Can be done as a daycare surgery. Drains are usually not put in a mastopexy. The individual wakes up with wearing a compression garment, which they need to use for at least 6 weeks. Contact sports will need to be avoided in the first 6 weeks. Scar management techniques are taught, similar to the other breast surgery. Patient in agreement with the level of nipple areola that is expected, and scar management and garments needs to be undertaken for this surgery. I think we have covered, taken more time than what we needed today. If there are no further questions, we will call it a day today.